Have you been advised cataract surgery but are wondering that there might be some risks associated with it? Hi, I am Dr. Surbi Taneja and let's discuss about the risks and complications associated with cataract surgery. Cataract surgery is the most common and safest surgery out there. But yes, it can have some complications or risks. First, let's talk about what is cataract. Cataract is a normal aging process. So in your eye, there is a structure that is called as lens. The lens helps you to have clear vision. With age, there are some senile changes that occur in the lens, and the lens is not able to give you the clear vision that it was giving you before cataract. And therefore, that cataract needs to be extracted out of your eye. Now, this lens is actually present in a bag. It is not attached to the anterior or the posterior surface of the bag, but just lying inside of it. And it is attached in the eye through zonules which are present 360 degree. Now, in the cataract surgery, we make an opening in the anterior part of the bag, which is a circular opening, and then with the help of the machines, we take out the lens and remove the cataract, and now there's nothing in the eye. So after removal of your original lens, we place an artificial intraocular lens in the place of the original lens in the bag. And now this new, fresh, clean lens will give you good vision. So intraoperatively also some complications can occur. Let's talk about them. Though cataracts, again I will say, it is the safest surgery, but intraoperatively risks can happen in case it is a mature hard cataract. Now, if a cataract has become hard, then over time, of course, its weight will increase. Now that weight cannot be sustained by the bag. So when we enter your eye to remove the cataract, sometimes that bag might give away, it might tear on its own, and the lens will fall behind in the vitreous cavity. In that case, you will need an additional surgery to remove the lens through a retinal surgery. Now, the surgeon might not be able to put a fresh new lens in the first sitting, but yes, the lens can be put in the next surgery, that is when the VR surgery is done to remove the lens. Now, another case in which such a situation can arise is a posterior polar cataract. What happens in posterior polar cataract? Now the lens, as I told you before, that is not attached to the bag, neither anteriorly nor posteriorly. It's just lying inside the bag. But in case of a posterior polar cataract, that lens is attached to the posterior aspect of the bag. So in that case, again, when we enter the eye to actually remove your cataract, the capsule or the bag might just give away and the lens may fall into the vitreous cavity, and then the same thing will follow. Otherwise, intraoperatively, there is very less chance that any kind of complication take place. Now, let's talk about the complications that can occur postoperatively, that is when the surgery is done. So the first one is corneal edema. See, cornea is the anteriormost part of the eye that gets affected when the surgery is being done intraocularly. So sometimes what happens post-surgery, the cells of your cornea may swell up and they will lead to edema, and that will cause decreased vision the next day of surgery. So the patient might be able to see better than before, but the vision is not 6/6. But this corneal edema will resolve as we will start the medications. Like in every surgery, there is a reaction from your body. Similarly, your eye also reacts after cataract surgery. So there is inflammation in your eye. This inflammation can lead to a disruption of vision post-operatively, but as we start the eye drops after surgery, the inflammation resolves and you're able to see clearly and get a good 6/6 vision. Another complication that occurs is dry eyes. Often patients would come and complain that they are experiencing watering, foreign body sensation. So all of these are the symptoms of dry eyes. Now, why do the dry eyes occur? Number one, the ocular surface has been disturbed because of the surgery, and therefore that leads to dry eyes. Second, there's a lot of inflammation. Inflammation itself is a cause for dry eye. And third, the eye drops that you are putting to control the corneal edema and the inflammation, which are the side effects that I have told you of the surgery, to control that, the drops that you're putting will actually cause the dry eyes. Now you say, okay, let's not put the eye drops. Now that's not okay. You have to put the eye drops to control the other side effects, but the side effect of the eye drops itself is the dry eye. And therefore, we also prescribe lubricants to the patient so that the dry eyes can be countered, and over time the dry eyes will resolve. But in case a patient has prolonged dry eyes, they will need lubricants for a long time. Another complication is droopy eyelids. So almost 21% patients may experience droopy eyelid. Again, that is a reaction to the surgery. Permanent ptosis or droopy eyelids is very rare. It may happen because of the speculum that we use to open the eye, but it's quite rare. Mostly the reaction, it will also resolve and the eyelids will get back to their original position. Often patients, they complain of seeing new floaters in their field of vision. Now see, first you had cataract and you were not able to have good vision, so the floaters were not visible. But after cataract surgery, the floaters become more visible because now there is a very clean lens in your eye which is providing you good vision. Not only that, after cataract surgery, there is a chance that you may experience a posterior vitreous detachment, and as the vitreous detaches, it forms clumps, and that clumps, the shadow of that clumps is seen by the patient as floaters. So yes, the floaters will resolve. You have to ignore the floaters. Slowly your brain will stop perceiving it or suppress the images of the floaters, and you will have a clear visual field. There is one not very common complaint, but often patients sometimes say that they see a shadow in the periphery of their field. Now this is known as Dysphotopsia. So what happens is, it depends on the design of the lens that has been put inside of your eye, and sometimes the edge of your capsular axis can also cast a shadow. Again, over time this will resolve. These are not permanent side effects. They occur for some time and then they resolve on their own or with the medications. Now, but there is one long-term complication of the cataract surgery, that is a posterior capsular opacification. So what happens after some time, maybe say 6 months, 1 year, 10 years, the patient will come and say that their vision has dropped in the eye that underwent cataract surgery. So what happens is that there are some cells inside the bag which may have been left inside that bag, and they're very minute cells. They are not visible. So even after a proper cleaning of the eye at the end of the surgery, some cells might remain, and those cells will proliferate later on and will form a membrane behind the intraocular lens or the artificial lens that we have put inside your eye. So now that membrane is actually going to cause a decrease in the vision. The cataract surgery would have been uneventful. There was no complication intraoperatively, and yet the posterior capsular opacification can develop maybe months or years later from the original date of the surgery. So again, this is not a permanent complication. It can be treated with the laser capsulotomy. So there is a device which is called as Nd:YAG laser. So what we do is we make the patient sit on a slit lamp, and then we basically laser the central part of the membrane, and since now that part which was in the visual axis has been removed, the patient is able to see clearly again. So these are the most common complications of the cataract surgeries, but as I have told you, none of these are permanent complications. They can all be resolved, they can all be treated, and therefore that the cataract surgery is called as the safest surgery. So if you have any doubts related to the complications, just write down in the comments and we will answer all your questions. Thank you.